Hi everyone. So I am going to try to live stream. So I'm going to try and live stream. Again, it's like the fourth or fifth time I'm trying to go live on YouTube. And I'm not sure if this is going very well. There have been a couple of people that have been joining and leaving, and I think I've just bombarded you with a lot of like notifications. I'm not really sure how this works because I haven't really done this before. I don't really live stream. I tend to just pre-record my videos. Anyway, so my name is Stefan Stanel. I'm a pulmonologist. This is my YouTube channel where I talk about lung disease in an easy to understand way, I hope. And judging from the feedback that I got so far, it seems like some of you did enjoy the content. Some of you have asked me several other questions. There are a lot of things I'd like to discuss about lung disease. I think it's a fascinating field. A lot of people do struggle with lung disease. There's lots of issues that we may need to explain a little bit better as doctors, and to just bridge the gap of communication between doctors and patients, really, because I think that's the main thing that's keeping some people from being more healthy than they could be. So anyway, let's just dive into the topic of today, which is familial pulmonary fibrosis. So I'll be talking about that on this channel. Now, I'm not sure if anyone has joined so far, and I don't know if anyone will join because obviously this is the first time I'm streaming live, but I will make this available as a recording for later use. At least I will try. So I've tried a couple of times already. I'm sorry, I'm not going to bore you anymore, but I'm going to just start again, because this seems to be a little bit odd. So anyway, today's topic, familial pulmonary fibrosis. So I've got a little document here that I'm going to just pop on the screen for you. Let me just quickly go to it. Sorry, please bear with me while I'm getting my bearings here. I hope that you'll be able to see that. So I'm just going to move some of these windows out of the way, and hopefully you can see the document. Right. Okay, so I'm just going to leave the corner of the chat window here. This is the YouTube thingy. But basically, we will be talking about familial pulmonary fibrosis. Sometimes this is also called familial interstitial pneumonia. So you can either call it basically FPF or FIP. These are all theoretically equivalent terminologies. Some people prefer this one, some people prefer this one. When we talk about fibrosis, we also generally talk about lung scarring. So it just means lung scarring. Now, lung scarring can be caused by a lot of things. So there's the idiopathic form. So when we talk about idiopathic pulmonary fibrosis, we talk about a condition that doesn't have a known cause. So we are unable to find the cause. So basically this will be an indeterminate cause of lung scarring. And I'm just putting these definitions here on the screen because I think it's really important to just have them handy when we talk about familial cases. So pulmonary fibrosis, like I mentioned before, can be caused by a lot of things. So causes could be occupational exposures to dusts, fumes, all kinds of things. Asbestos is a big one. So occupational exposures. It could be things around your environment that are triggering an inflammatory reaction in the lungs, and that's something that we can sometimes call hypersensitivity pneumonitis. I did talk about this in a previous video. Right? So, but these are known causes. So I'm just trying to give you these little bits of background because I think it's really important to understand that there may be conditions causing the pulmonary fibrosis, and then we don't call it idiopathic. We call it, hypersensitivity pneumonitis, say asbestosis, etc. We also have autoimmune conditions which can cause lung fibrosis by involving the lungs as well. So one big one here is rheumatoid arthritis. Let me just type this down. So autoimmune conditions Now, what is an autoimmune condition? It's where your body is producing certain proteins that attack their own tissues. We call these autoantibodies, and they activate the immune system. And one big one is a condition called rheumatoid arthritis, which is a very well-known condition. Rheumatoid arthritis, right? So we shorten this usually as RA. Now, when we have one of these conditions, we may get pulmonary fibrosis. Idiopathic, like I said, means indeterminate. So if we were to just cause idiopathic, means indeterminate. Now, why did I give you all this background? Because obviously many people can be diagnosed with these conditions. There are a lot of types of pulmonary fibrosis which can be diagnosed. Now, normally you may have cases which are caused by one of these things, but there may also be a familial predisposition. Someone may tell us that, look, I've been diagnosed with pulmonary fibrosis, but also my father had pulmonary fibrosis, or I have an uncle who also suffered with rheumatoid arthritis and lung fibrosis. But the patient themselves, the person who is presenting to the doctor, may have a slightly different condition. And this is because pulmonary fibrosis that is of familial nature can be actually there can be relationships between different conditions that don't seem on the surface related at all. And this is because familial pulmonary fibrosis can be caused by certain genetic variants, genetic mutations in something called telomere-related genes. So let me just write this down because it's a little bit of a mouthful. So telomere genes. So obviously when we talk about our DNA codes, the building blocks of our life really, so the information that's packed inside the nucleus of all our cells that actually makes us who we are. When we talk about the DNA is organized into chromosomes. Now, chromosomes are just basically, if you imagine the code of DNA, it's just packed together, tightly packed in these structures called chromosomes, which are held together by different proteins. Now, at the end of the chromosomes, there is something called telomeres. Telomeres are just bits of code, bits of DNA code that are repetitive, and during moments when our cells divide, from one cell you get two cells and so on, when the DNA needs to multiply, because you need to have the same quantity of DNA from one cell to the next, what tends to happen is that these telomeres protect the DNA packed into chromosomes from degrading, from becoming mutated, changed, etc., which would lead to illness. So the telomeres protect the DNA. They protect the genetic codes. It's an extra bit of code that protects the rest of the code, if that makes sense. So the telomeres themselves, during cell division throughout our lives, they tend to shorten. So as the telomeres become shorter, at some point there will be genetic instability in that DNA. So when that DNA becomes altered, we may get premature aging. So sometimes familial pulmonary fibrosis is related to premature aging. And this is something that is quite difficult to wrap your brain around, because someone may have a normal age. They may not be considered elderly. Someone may be 50 years old. So you may have someone who is actually 50 and their lungs have become scarred. They have a lot of various conditions in their body that seem to be related to aging. And that's very, very unusual. It's very, very strange. So basically, when we talk about these situations of premature aging, we have to take into consideration that there may be familial pulmonary fibrosis. So where we talk about familial pulmonary fibrosis, we need to ask a couple of questions. Are there other conditions present? And normally what we do is we tend to do a little bit of a questionnaire. So I'm just going to go to a new page here. So when someone presents with pulmonary fibrosis, we need to try to determine whether in their family there are other conditions which are related. And we tend to ask our patients a couple of questions. Now, obviously, the first question to ask questions. So we need to ask the first question: is there anyone else with pulmonary fibrosis? So I'm just going to shorten this as PF. Anyone else with pulmonary fibrosis in the family? So blood relatives who may share a genetic component. So if the answer is yes, it's very easy to say that there is familial pulmonary fibrosis. But it's more complicated than that, because these telomeres that I've been mentioning here before, they can actually be responsible for other conditions as well. I mentioned the premature aging. Normally, number 2 is that pulmonary fibrosis appears in that particular patient before 50 years old. This is usually a very noticeable thing. I would say I could extend this even before 60 years old. If you have cases of IPF, it's probably quite suggestive that there's may be something going on. Normally, IPF is a condition of older age. So if it occurs earlier, this is a little bit unusual. Other questions that we ask. There may be personal or family history of other things, other conditions. And here, I will just put a couple. So is there any hematological disease? So here we talk about things like leukemia, myelodysplasia, anemia requiring transfusion in the person who presented with pulmonary fibrosis or other relatives, because this may also be related to these telomeres that I was discussing before. There may be a genetic predisposition for getting these things. The other thing to ask is about autoimmune conditions, because the reason why we ask this is because sometimes these genetic predispositions can be associated with an abnormal functioning of the immune system. And that's also another difficult situation. Now, other things that we would ask about is early gray hair. So this sounds a little bit odd, but basically if someone has early gray hair before 25, so if you have early gray hair before the age of 25, this is not necessarily a sign of disease, of course. Many people can have that for various reasons. But if you have many family members with the same situation, so many relatives with early gray hair, we may consider that that could be part of this big picture that I'm trying to present here, that I'm trying to draw. Other things that we can ask about is early menopause. So someone who may have gone through menopause before the age of 45. This also may be relevant if several female relatives have undergone menopause early. Another issue that may occur is that there may be unexplained liver disease. So if you have unexplained liver disease, not related to alcohol, for example, so let's present non-alcohol related. So someone who may just develop liver disease for no reason, no non-alcohol related, no hepatitis. Someone just randomly develops liver disease in the family. Then you've got early menopause, early gray hair, autoimmune conditions. So for example, rheumatoid arthritis, scleroderma, etc. Others, hematological disease, so things like myelodysplasia or leukemia, etc. Things like that may suggest that there may be pulmonary fibrosis there. And the final thing that I'd like to just say is it could be two other conditions that would draw attention to this fact. So one is aplastic anemia or dyskeratosis congenita. I'll explain in a second. So if these conditions, if you've heard of these conditions in the family, they are a telltale sign that there may be telomere-related issues, because these are conditions which are related to short telomeres. So hopefully you can understand that by writing this, I'm trying to draw a little bit of a picture of who might be actually suffering with familial pulmonary fibrosis. So this is just a little bit of a questionnaire that can be, done by anyone really, to determine whether the pulmonary fibrosis may be related to familial cases. And the next step after we've done this is to then try to build a little bit of a family tree. So we would need to then draw a family tree. Sometimes it's called a pedigree. I don't particularly like the term pedigree because it sometimes reminds me of dogs and canine things, but it's a little, I find it a little bit odd when you talk to patients and talk about their pedigree. But I would say if you can just think about genealogy, and family trees and things like that, usually patients are quite keen to talk about that. So this is more or less what I do in my clinic. I run that questionnaire that I mentioned above, so this one here, to try to determine if I am really looking at a case of familial pulmonary fibrosis, which may be related to telomeres. And then I do a family tree, because this will allow me then to determine who is related to who. Is there a case, for example, of pulmonary fibrosis or a related condition in one generation, but then in the grandfather, for example, but then the father and the brother had related conditions, then the patient who is consulting has this problem if some of their children are affected by early symptoms of disease. And then this helps us because the family tree allows us, let me write this down, to determine who is at risk of pulmonary fibrosis, but also other related conditions, which are telomere related. Now, obviously, the telomeres are one of the biggest, short telomeres are one of the biggest risk factors for developing pulmonary fibrosis. There could be other things as well. There are a lot of unknowns in this field. But I guess I just wanted to give you a little bit of a suggestion of how we might uncover these cases. So you can imagine asking about family history, trying to draw out a family tree is very, very important for determining whether someone is actually suffering from pulmonary fibrosis. So this is, just basically there are comments that are starting to appear on my channel about pulmonary fibrosis. Slowly. If you have more, I would really like to answer more of these. The implications for this, because I think that's really important. So I'm just going to maybe go back to the document because I think that's quite helpful. The implications when we discover cases of pulmonary fibrosis that are familial in nature is that these individuals may be at risk for other things as well. So, for example, let me just go a little bit further down. So, if you have a person who suffers with pulmonary fibrosis, they may have more rapid progression. They may also have poor tolerance to very strong treatments, so very strong immune suppressant drugs, because we need to use these sometimes when we are treating certain forms of autoimmune disease, for example. So worse tolerance to immunosuppression. And this is not a great thing. And then these patients may require early lung transplant referral for the above reasons. And then when we talk about lung transplant, we also need to circle back to immunosuppression because when someone receives a lung transplant, they will need to basically be treated with very high doses of immunosuppression to prevent the rejection of the new organ. So then we need to tailor immunosuppression. And this is depending on what genetic abnormality is found. So basically, genetic abnormalities, predispositions to pulmonary fibrosis, they require a lot of attention. So these are things that we need to really, really consider when we talk about these cases. And of course, another very important thing to mention is that we will probably identify family members at risk of developing pulmonary fibrosis or other related conditions. And then we can then suggest early screening. In the case of pulmonary fibrosis, if we catch IPF, for example, early, we have a better chance at slowing down the disease with treatment. But sometimes cases present quite late. So when someone presents really late with pulmonary fibrosis, it can be really, really difficult to actually give the right treatment. The treatments that we have for IPF at the moment, so we have antifibrotic treatment. And antifibrotic treatment, unfortunately, only slows down the progression. So you can imagine we need to catch this early. So having the genetic information that there may be a risk in the family will allow us to potentially test other family members and then bring them in for screening for their lungs, for other potential serious conditions. So for example, if you're thinking about leukemias, myelodysplasias, rheumatological disease, things that may have, you may benefit from an early good treatment. That's really, really important. Now, it's really important, though, to just mention one caveat here. So when you are doing genetic testing, it's a bit of a Pandora's box. So the reason why I say that is because many people don't want to know what happens if you know that you are going to develop some strange condition. And the problem is we don't really know for sure. Sometimes you may have these predispositions and you may not actually develop the disease. Sometimes the genetic test that we do does not cover all the possibilities. So we may be lured into a false sense of calm, that there's nothing wrong, but there's something we cannot test for. So there are a lot of these situations where we need to really cover all our bases. So I'm not sure if this was a helpful video. It's a little bit all over the place. I tried to use the document to just write down the concepts that I think are key. So just going back to it and to quickly summarize from the top what I've written here. When we talk about familial pulmonary fibrosis or familial interstitial pneumonia, different terms, we're talking about lung scarring, which can or cannot have a known cause, so it can be an indeterminate cause, and then we would call it IPF, or not. Or it can have things like occupational exposures. But anyway, regardless of the cause, we end up with pulmonary fibrosis. If there are other cases in the family, we need to think about whether this could be related to telomere-related genes. So these are telomere proteins that are coded by certain genes in the DNA. If that is abnormal, it means that the telomeres may actually shorten earlier. The telomeres, like I said, are the caps at the end of chromosomes. They are sequences of repetitive genetic code that shorten progressively with time and protect the chromosomes during cell division. So they protect the DNA from damage. If these shorten faster, because there are issues with these telomere-related genes, we may end up in a situation where we get premature aging. This can lead to quite serious conditions happening before the age of 50 or 60. And then we can sometimes screen for these sort of situations by asking these questions. So, is there anyone else with pulmonary fibrosis in the family? Did the case occur before the age of 60? Are there any other situations, any other conditions that are serious that have been uncovered in the family? So hematological disease, unexplained liver disease, autoimmune conditions, early gray hair, a bit of a strange one, early menopause. And then these two conditions, aplastic anemia or dyskeratosis congenita, I will not go into what these conditions are because they are very rare conditions, but if they do occur, they are generally related to short telomeres. And then it's important to run a family tree to try to ask about parents, grandparents, uncles, aunts, children, partner, to just see how everyone is related, who may be at risk. Because we want to know who is at risk of pulmonary fibrosis or other related conditions, which are telomere-related, to suggest early screening. Because then if we offer early screening, we may be able to then identify who is at risk of a rapid progression of their pulmonary fibrosis or other related condition, who may have a worse tolerance to immunosuppression if they require it for the treatment of, say, rheumatoid arthritis or something like that. If then they require early lung transplant referral because of the risk of progression. And then if a lung transplant is performed, we need to tailor the immunosuppression. So basically, if we find IPF as a condition, we need to think about antifibrotic treatment. That's what we have at the moment to slow down the decline. But we do not have a treatment to reverse IPF, unfortunately, at the moment. So we need to catch it early. So this is basically what I wanted to cover in this video, this live stream. Let me just quickly check if anyone joined the stream. I don't think so because this is the first time I'm doing it. But in any case, thank you very much for watching this. It was a bit of a slow-paced video. I hope I've managed to cover many of the questions that you had about pulmonary fibrosis that is familial in nature. And if you have further questions, please do leave them in the comment section below the video. I will try to make this recording available to you at the end of the live stream. So thank you very much for watching, and I will see you in future videos. Thank you very much.